Welcome back to our channel, and thank you once again for joining us in this another episode of Living on the Autistic Edge. I am Terry and Alleyne, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on the Autistic Edge. One of the challenges faced by parents of children on the autism spectrum is managing behavioral issues. This week, we are going to be sharing with you some tips and tricks of how to manage behavioral issues with your children on autism spectrum. Behavioral issues can take many forms. Now, the child can be having a tantrum. You will see the child having meltdowns. You have to know the difference between tantrum and meltdown. You may have weird, repetitive behavior. You may have some behavior that just makes no sense. The reality is it makes no sense because you as a parent does not understand. Now there is a difference. Now, I spoke briefly a while ago about tantrum and meltdown. I want to talk a little bit about that because it tends to be a little bit confusing at times. There is a difference between tantrum and meltdown. A tantrum is triggered by frustration and or anger when a child doesn't get what they want, or this can be like a lack of self-control with the child. So they will throw down themselves on the ground, they may throw things, and all of those behaviors that just tend to agitate the parents. Now, the tantrum can be more on the rude side. Now, that within itself can be a rude behavior, right? When children don't have their way, they throw a tantrum. The meltdown, it's an overwhelming reaction caused by sensory inputs. Now, for the child on the spectrum, they have sensitivity to their environment, or sensory issues we would have referred to them have. So some of the issues, they may have sensitivity to noise, they may have sensitivity to lights, crowded areas, toys, some animals, and even changes in their routine as well can put them into a meltdown. Now, the behavior of a meltdown and that of a tantrum at times can be similar. And one of the ways in which you can identify the difference is, again, I use a process of elimination. And I try to understand the environment, what is happening in the environment at the time when the child goes into one of these behaviors. So, for example, I remember one here, we went to a function at the National Arena and we were so excited. It was a very, very large function. And when we got there, we went inside, we sat down, and for the first 5 minutes, Alex will just not have it. He was uppy, he almost went into a fit. Now, his daddy took him outside. We thought that he was just a little bit frustrated. So daddy took him outside. We thought he wanted something to eat. Daddy took him outside, and once he was outside, he was fine and okay again. Now, when my husband brought him back inside, again he went into another fit. Now, it was then that we realized that Alex is highly sensitive to crowded areas. So anywhere you have too much people, it's going to be a challenge. It pushes him into a meltdown because there are so many things that can be coming at him in a crowd. It can be the noise from the crowd, it can be lights from whatever is happening in the environment, and all of these things. So there's a lot of things. So what it does, it creates a kind of overwhelming feeling, and one of the ways for them to really soothe themselves is to go into this meltdown. Right now, understanding the environment and looking at the series of events that leads up to the meltdown or the tantrum can help you to understand whether or not it's a meltdown or a tantrum, because the behavior sometimes can be similar. So you have to know exactly what is happening. And so parents, We just have to study our children. We just have to know our children for us to understand. Know the difference between the tantrum and the meltdown so that the appropriate strategies can be implemented in helping the child and better able to manage your mind, because it can be an overwhelming feeling. I know that. Here are some tips that can help you to manage the behavioral issues with your children on the autism spectrum. Now, remember, these tips can be used for other children as well, but we are speaking specifically about our children on the spectrum. Tip number 1, structure your activities. Children on the autism spectrum, some of them tend to like structure. Now, what structure does? Structure develops a routine, right? When you have structure, you develop a routine or you organize your activities. When you organize your activities, it can be very predictable for the child, and it can also be adaptive. So, say for example, you have a morning routine. Once the child is up, they will go to the restroom, they will brush their teeth, they will wash their face, they'll dry their hands, and the next thing they may have a little morning chore, and then there is breakfast, depending on whatever you like for your routine for your child, but something simple. Now, what happens is when you do that and it is predictable and adaptable, the child will be more cooperative. And for you, the parents, it gives you more peace of mind. So, because sometimes if the routine is missed or it's disturbed, the child can go into a meltdown, right? But at least right away, you can know what is happening in your child. When there is a miss in the routine, it is easily identified, and you can come quickly with one of your calming strategies on how to diffuse that particular behavior. Routine will also develop trust, and it also reduces anxiety, both for you, the parents, and also the child. Tip number two, use positive reinforcement. And we spoke about this last week in this video where we talk about how to develop patience, right? Use positive reinforcement. Reward your child for good behavior. Positive reinforcement such as praise, it can help to reinforce positive behavior. Also encourages your child to do the right thing or to behave in a particular manner that is desirable. Now, that is more peaceful for you as a parent, because when you go out or even at home or wherever, what we always want is our child to be on the good behavior. So therefore, reinforce the behavior that you want, and they will likely to keep on board. Tip number 3, set clear expectation and boundaries. Now, be clear about the behaviors that you want or what is expected and what is acceptable. Be clear about it. Now, because a child is on the spectrum does not necessarily mean they don't understand. Oftentimes, they understand. They understand what they are doing. Don't underestimate them. They are brilliant. They just do things differently. So we need to focus on that. So our approach to something may be just one way, but the thing is, that approach may trigger some behavior. So learn their style and make sure that you can have an acceptable behavior in between. But set the expectation and set the boundaries. When it comes to children on the spectrum, we need to lay down the rules and the regulation. Lay down the boundaries. They know when they're doing something wrong. I mean, sometimes, Alex have this fixation to sensory, like anything soapy. So from time to time, you will catch Alex in the room with his lotion, and he would do a nice plaster on his plastic bag, and he would just be there rubbing it. Now, when you see that it is quite a bit messy, right? And you're like, no, you don't want that to happen. But you know what? Sometimes when you walk in and you see what he's doing, he stopped and he would be there staring at you. as if, okay, he does something wrong. Or sometimes when he see you coming, then he will put it down and he squinch in a corner and he would try to run because he realizes that he has done something wrong. So therefore, they understand when they are doing something wrong. So therefore, we need to set the expectation. And whatever expectations you set, make sure that you hold out on the expectation. So don't say today, you're not going to allow him to do this. And then because you're frustrated, then you're allowed to do it. But guess what, parents? I do understand that sometimes, because sometimes I will say, all right, time to put up the tablet. But then when you have the housework to do and you have other things and you are tired and you yourself are overwhelmed, one way to get them is to just say, hey, go ahead with your tablet, because when they have the tablet. But that sends a different signal, because then they will feel that at all times they can come and get into a fit and they will get the tablet. So we have to reinforce the behavior that we really want. All right. Tip number 4, use visual supports, such as pictures or some calming effect, right? Help your child to understand what is accepted of them, and you may have objects and stuff that can reduce the behavior, right? So whether you take them for a walk or it's one of their favorite toys, know your strategies. When you understand what causes the behavior, you can implement the right strategies, right? Now, number 5, teach coping skills. You have coping skills such as deep breathing, counting. Some of these things help them to manage their emotions. Now, I know that there are times when Alex is very upset, and when you want to get him to calm down, we say, all right, come on, Alex, let's do a jump on the trampoline. And he loves the trampoline. So he started bouncing away on the trampoline. Now, when he bounces away on the trampoline, there's a little soothing effect from that bouncing and that calming effect. So while he's bouncing, we say, all right, let's count from 1 to 20. And, he will start counting and he's crying and he's counting. But then by the time he do a few bounce, he may not calm down fully, but at least you see the difference when he comes off that trampoline. And so we have that, and sometimes I say, okay, take a deep breath. Or normally I say to him, calm down. Now, this will not work for every child. So again, you need to know your child. But whenever I say, calm down, he will repeat after me, calm down. And we will say, calm down. And, we'll repeat. I will say, calm down, and he will repeat the calm down. And then after a while, he slowly goes into a lower tone. So parents, understand your child. These tips, they are not conclusive. They are trial and error, and you just have to, these are just some that you can try, but you can come up with your own strategies as to how you manage these kind of behavior. Now, one other thing in managing behavior, seek help. Sometimes the behavior of the child tends to get the parents very frustrated, agitated. If the parents is in a public area, sometimes they can feel a little bit ashamed because of the behavior of the child. And sometimes when the parent feel ashamed, they might just want to give the child some lick or some thump. You ever see some parents sometimes when they just fist and them shout at the child and all of these things? Not right. So all of these little stuff are just emotions flying out of control. So we just want to practice so last week we talked about take a break. Yes, sometimes step away. So if mommy is dealing with the situation, sometimes mommy needs to step away and allow daddy to take over. My husband and I, we do that a lot. So if I am in the middle of the situation and my husband see where I'm getting a little bit annoyed or getting, agitated, sometimes my husband say, okay, dear, you take a break and let me take over. And my husband's strategy will be different, because I would be there saying, calm down. But then my husband will come in and probably use music, because he loves music. and Lowen will come sometime, and he will play a nice music. And once he hear his favorite song, he started singing and all that. And sometimes vice versa, we have to do the same. Sometimes my husband just probably overtired and just not the time to be dealing with this. And I may have to step in and say, all right, dear, you get some break, or you get some sleep, and let me deal with this. So it's good to have that support at times. And it's good to have, last week we spoke about family support, whether it's family support, friend support. It's good to have the support at times where you can just take a break and recoup from these behaviors. Now, these behaviors really and truly test our patience. And I do understand, but that is why it is important for you to watch the patience video so you can learn how to develop the patience. And last but not least, seek professional help. Seek professional help. If you realize that the child behavior is causing significant problem at home or school, consider seeking professional help. A therapist, a specialist, they may be able to provide you with additional strategies and support in terms of how you can help your child. But it is not okay to sit and do nothing. Try something. Remember, every child on the spectrum is unique. And what works for one child will not work for the other. What works for my child may not work for your child. So therefore, be patient, be flexible, be willing to try different strategies until you find what is best for your child. Once again, thank you so much for joining us in this another episode of Living on the Autistic Edge. Don't forget to like, comment, share, and subscribe. And guess what? Hit the notification bell, please, so that when we upload another content, you will be notified. Thank you.